For those that don't know, March is Colon Cancer Awareness Month, and I've been given the opportunity to share a few thoughts about colon cancer screening. Colon cancer is a cancer that's quite common. It's the third most common cancer in men and women in the United States and affects about 55,000 people a year. Colon cancer screening, among other types of screening, was significantly impacted by the COVID pandemic that developed a year ago. Because of uncertainty regarding infectivity and mortality, hospital systems were closed in the beginning. So a lot of colonoscopy screenings a year ago were canceled and rescheduled until later in the year. And some patients haven't come back to the hospital yet. We're here to tell you that our hospitals are safe, that the doors are open, that colonoscopy screening is recommended, and that in fact all cancer screenings and preventative medicine is recommended to patients that maybe have deferred those studies from last year. One question that comes up is, if I defer my colonoscopy screening, if I decide not to do it, what kind of risk am I facing? A colonoscopy screening is used to detect precancerous colon polyps. Polyps are abnormal growths of tissue in the colon that over time, many years, can develop into colon cancer. It's never too late to do your colonoscopy if it hasn't been done. Someone may say, well, what does it feel like to have colon cancer? I think the important point to make is that for some patients, they don't feel any symptoms. If a patient has colon cancer, one of the risk factors or symptoms that would prompt us to recommend colonoscopy screening is unattended weight loss, rectal bleeding, abdominal pain or back pain. New changes in bowel habits or frequency are symptoms that would prompt us to look at colon pathology, doing a colonoscopy evaluation. But important to know also that many patients with colon cancer, there are some patients that have never had symptoms when they have it. There are risk factors for development of colon cancer, and it's important to talk about those risk factors. One of the most important risk factors is to have a family history of colon cancer, especially in first degree and second degree relatives. A parent or a sibling with colon cancer increases your risk of developing colon cancer. There's other risk factors that are genetic. There's genetic syndromes called Lynch syndrome and familial adenomatous polyposis that dramatically increases the risk of colon cancer. There are lifestyle factors that play a role as well. Poor diet, it's high in processed meats and red meat, high in fat. Obesity plays a role. Alcohol and tobacco use also play a role. In the last 5 or so years, it's been recognized that younger people are developing colon cancer at a higher rate than at any previous time on record. So it is recommended and advocated that a patient at 45 years old undergo a screening colonoscopy. Colonoscopy is highly effective at detecting precancerous colon polyps and significantly decreasing and altering the risk of colon cancer in a patient.